Welcome back to another episode of Black Facts. Today we're going to be talking about unpacking health literacy. I'm sure you're wondering, what is health literacy? Health literacy is the extent to which you have the ability to find, understand, and use information and services to make informed health decisions. That was a lot, right? Well, basically, like the saying goes, knowledge is power. But what is knowledge if you don't know how to apply the knowledge that you've learned? So we're going to talk about health literacy and how important it is. And you're probably wondering, well, why is it important to be health literate? Why is that important to the Black community? Well, I'll tell you why. Low health literacy is a predictor of racial and ethnic disparities in health behaviors. So, example, like we don't understand possibly how to follow a treatment plan because we're not health literate. We don't know how to access healthcare services or resources. And so that's a contributing factor to our community's poor health outcomes. So we need to understand and really appreciate the importance of being health literate. So what that often means is sometimes we're not even capable of making a doctor's appointment. And I know you're thinking, no, I know how to make a doctor's appointment. It's pretty easy. All I have to do is schedule an appointment and go in and see my doctor. Well, that does seem pretty easy, but it's not that straightforward. There's more that goes into it, or there's more that you should be doing in preparing to go in to see your doctor. First thing, so I have a list of things, so get ready so you can take some notes. The first thing you should do is make a list of things you want to discuss with your doctor and prioritize your concerns. It's really, really important to go in and be prepared to have a conversation with your doctor. Your doctor is a regular person. They are actually there to help you make sure that you are able to not only sustain, but maintain your optimal health. So be prepared, go in and have a list of your concerns or issues that you want to discuss with your doctor. Second, take information with you to your doctor. Make sure you share your family history. It's so important that we're aware and knowledgeable about illnesses and diseases, that because your doctor doesn't know you, they don't know what things have happened in your family. So it's important, first of all, it's important that you know what your family history is prior to going to see your doctor. So you need to know what kind of ailments or diseases that run in your family, or what things maybe an immediate family member like your mother, your father, or a sibling has passed away from. So, for example, if they passed away, if you have a grandmother that's passed away from colon cancer, you want to be able to share that information with your provider, because it's important for them to know these types of things so that they can test you for possible signs of colon, cancer. They can make sure to monitor you. And if in fact they do detect something, it will be detected early so you can get the proper treatment that you need. And then also, if you've seen a previous provider, say you've moved from one state to another state, you want to take your list of medications, or if you're taking vitamins, all of those things you want to ensure that you're sharing with your doctor so that they can help you, again, maintain good health. The third thing is, consider bringing a family member or a friend with you to your doctor's appointment. It will help keep you calm if you're often nervous or anxious when you have to go to the doctors. And most people are. They become, their blood pressure is a little elevated, and it creates anxiety in people. So if you are one of those people that, you just do not like going to the hospital, medical center, or just to see your provider, even if nothing's wrong, please make sure that you take somebody with you. It will help keep you calm. And then also you'll have another advocate, somebody there to help you, make sure that you're sharing your thoughts clearly, make sure that they can share information if they're noticing things that has changed in your physical or mental health. They can be able to share their perspective as well. So take a friend or a family member with you to a doctor's appointment. And fourth, keep your doctor up to date on everything. Everything. So, for example, if you've been diagnosed with, let's say, hypertension, and you're consistently taking your medications or not, or say you're having side effects to the medications that were prescribed, you have to let your doctor know these things. You have to make sure to keep them informed and up to date. And even if you're not doing what you were prescribed to do at your last visit, do not, I beg of you, do not be dishonest about how you've been taking care of yourself. Be honest. If you have not been taking your medications, if you didn't even go to the pharmacy and pick up the prescription, be honest and tell your provider that, or if you've been taking it intermittently. So say you were really good the first couple of weeks and then you kind of, you would forget and you would take it, maybe on a Monday and then not take it again until Thursday. You have to share those things with your provider. They're not going to judge you. They're not going to chastise you. They need to know these things so then they can say, okay, well, maybe we need to help you figure out ways that you can effectively take your medications. Or maybe if you're experiencing side effects from the medications that were prescribed, they can give you a different medication that will go better with your system. So make sure you're telling your provider everything and you're not withholding or not giving them misinformation, because they cannot help you maintain good health if you're giving them bad information or not giving them any information at all. And then last but not least, take notes. Come prepared. If you want to take notes on your phone, if you're a writer like me and you want to carry a little notepad with you, take your notes. It's so important because we have to make our health a priority, right? And it's important for us to understand what's going on in our body. So bring your notepad, take notes about important things that your doctor says. And again, things you only have like 15 minutes. So that's not a lot of time to be able to get, your thoughts out. So if you have things already written down and you're prepared, and then you're also prepared to write notes so that you know what needs to happen after you leave your appointment. So say, for example, you're being asked to go, your doctor says, okay, well, you share some things with me and we need to do some follow-up lab tests, or I need to refer you to a specialist. You can have those things written down. So when you leave, you won't forget and you'll know the next steps that you need to take to ensure that you're taking care of your health. And then also, before you leave, do not leave your doctor's appointment without getting an aftercare summary. That's so important. And there's so many people that do not know that that's even available to them. What an aftercare summary is basically the doctor's notes. It's an overview of the doctor's notes and your visit. So it will tell you what your blood pressure was, because oftentimes we go in and they'll say, oh, let me get your height, your weight, and they'll take your blood pressure and your temperature. And they don't tell you what it is, but it will be all listed on your aftercare summary, as well as the next steps. So if your doctor did say, oh, I'd like for you to go to lab, and even if you happen to not write those down in the notes, it will be in your aftercare summary. Or if the doctor says, I want to see you back in a couple of weeks, all that information will be in your aftercare summary. So make sure you don't leave your doctor's appointment without your aftercare summary. Okay? So, benefits of seeing your doctor for preventative care. Even if you're feeling fine, please schedule your preventative care appointments. We have to stop with this mentality of going in when we have a growth coming out the side of our neck, or there's been this aching pain in our back that will not go away and we can barely stand up. Stop doing that to yourself. Stop going in and being reactive and then being scared to go in because something's going on. Because like I said, either you got something growing out the side of your neck or you have this aching pain that's been there for months. Let's be proactive. Let's get our preventative care screenings and routine treatments. Go in and not only check on your physical health, but if you feel like you need some counseling, go and ask your provider when you go to your appointment and say, you know what, I'm here. Physically, I feel fine. Everything that, we talked about in the last visit has been going well. I haven't had any physical problems. But you know what? I've been a little sad or I've been a little anxious lately, and ask if they can give you a referral to get some counseling or some therapeutic treatment. Don't be afraid to take care of not only your physical, but your mental health. It's just so important. So let's be proactive. Let's get those early screenings. Let's go in and get our checkups. And actually, it's very, very easy to get your annual appointment. What I usually do is, and somebody told me this trick a long time ago, a physician friend of mine, they were like, do it around your birthday. That's your birthday present to yourself, you know? And if you're staying up on top of your health, it is a birthday present. You're not scared to go in because you want to go in because you're like, okay, I'm a year older. I'm feeling good, you know, and I'm going to go in and I'm going to make sure that I am good, right? I'm physically and mentally well. So schedule your annual preventative care checkups around your birthday or some other special date that you know you can remember, and it will be consistent. And you will know, you will look forward to those times where you are actually sitting and speaking with your provider. And hopefully you won't have to go in more frequently than that. But it's important that you do these things because then that allows you and your doctor to develop a care plan for yourself. And your doctor knows you, they know that you care about your health. You can have great conversations. Now it's so easy to communicate with your physician. You can, most healthcare plans have apps that you can go on and you can message your doctor and ask a question, or you can follow up with them. You can upload pictures, all kind of things. So treat your doctor like they're part of your, you know, your your crew, like to keep you healthy. They're, you know, a part of your entourage. To again, they are there to help you maintain optimal health. And in the event that something is not going well with your health, if you're having good conversations and you're engaging your provider and you're having conversations and they know who you are, I promise you'll be able to catch things early and you'll be able to possibly get the good treatment that you need. And whatever issue it is, it won't turn into a life-threatening issue. So I really, really hope that these tips that I've given you on how to be a little bit more health literate have been helpful. I really, really hope that you will take these tips seriously and you will implement them. Like I said, it's just a simple thing, you know, going to see your doctor. I'm going to share some other tips later on about being more health literate, but I think this is one important tip to start with, is to be prepared when you go in and you see your doctor. Make sure that you're making your health a priority and that you're doing everything that you possibly can to ensure that you're in good health. I hope this episode on health literacy has been useful. Please make sure to like, share, and subscribe, and come back for another episode so we can all know the facts. Take care.